Welcome back, folks, and thanks for sticking with us this Sunday morning. I hope you all are having a great day so far. Well, joining us now, we are talking about Thyroid Health Awareness Month, and we have Dr. Samuel Snyder here, and we also have Dr. Eduardo Luna. So both, thank you so much for coming in today. And tell me a little bit about yourselves.
Well, I work for the University of Texas, Rio Grande Valley School of Medicine. It's a brand new school that started in 2016, and we're here to develop medical students and develop physicians for the Valley. I came here in 2016 from my practice at the Scott and White Clinic in Temple. I'm a specialist in endocrine surgery, and I'm also now the chair of surgery for the university, trying to develop the medical school.
Wow, amazing.
Well, it's tough to follow that up, right? So again, Eduardo Luna. I'm originally Valley born and raised in Edinburgh, Texas. I just relocated back from San Antonio, where I did my fellowship training in endocrinology, and now working with the local practice here with Dr. McDougall at the RGV Adult and Geriatric Medicine Clinic, and just thankful to be back and provide back to the community that gave so much to me.
Definitely, and I'm sure the community is glad to have. They love, when you go and you learn what you can, then you bring it back and then help grow the Rio Grande Valley. So it's fantastic. So we are talking about thyroid health awareness. Now, tell us a little bit about thyroid, like in general. I know that there's some, in general, for folks that may not know, okay, what is this thyroid health? What should I be looking out for?
Well, thyroid disease is actually, it's pretty common. 20 million Americans are affected by their thyroid, whether it be overactive or underactive, and about 60% of those people are unaware that they actually have thyroid disease. It can be a myriad of different symptoms. You're looking at anywhere from temperature intolerance, where they feel too hot or too cold, weight gain, weight loss. Usually I get more of the complaints of the weight gain, unfortunately. Just different various symptoms that they have, and overall, a lot of times it can just be caught on regular screening by the primary care. And then by being able to identify these thyroid issues, we can approach forward to seeing what we can do as far as treatment options, and which is a wonderful thing now having endocrine surgery here in the Rio Grande Valley and Dr. Snyder and his associates, because we can work closely together to get most of these treatments or most of these diseases taken care of.
Definitely. And was this something that was a little bit more complicated a few years past to kind of take care of here locally?
I believe so, just because, for the most part, thyroid disease can be treated with oral medications, but at times, whether it be thyroid nodules or thyroid cancer, and even some of the very tricky, overactive thyroid cases or hyperthyroidism, another name for it is Graves' disease, require surgical, intervention. And, I think in the Rio Grande Valley, we've tried our best over the last, years to try to get that addressed, but now having these specialty surgeries here really makes a big difference. And on top of that, having the UTRGV Medical School really just brings that to light, and under the direction of Dr. Snyder, it's headed in the right direction, and the advancements coming down here, absolutely.
Definitely. And is there something, is it better to catch it earlier? Is there a difference between catching it at an early stage or a later stage, or does that matter at all, or how does that work as far as getting diagnosed or taking care of it?
Good question, because I come into play when growths show up on the thyroid, such as tumors, nodules, people notice swelling, goiter, and we have to evaluate that. Ultrasound has really helped us immensely nowadays, and so both of us do ultrasound, and we can determine where the problems are and actually diagnose the thyroid cancer at an earlier stage when it's more curable. There's no question about it.
And so what are some things that people should look out for as far as symptoms or things that, like, I'm feeling a little off, but I'm not sure what it is, or when should they know to go to their doctor to kind of look for something?
So in regards to the screening for the hypothyroidism, as you said, sometimes patients feel a little bit off and they're afraid to maybe seek that medical care because, of course, we're all kind of fearful of having some type of condition. But like I said, with the thyroid, it handles multiple things. It regulates for women as far as their menstrual cycle. It can be dealing with weight, as I mentioned earlier, temperature, even little mild shakes, things like that. So I get that feeling of being off in general. general, hopefully would raise the suspicion to go see your primary care doc, to try to identify if there's any abnormalities. Of course, when we talk about thyroid nodules, seeing any kind of growths on the thyroid, or just lumps and bumps around the neck area that you don't feel comfortable with, that would be a perfect opportunity to come, see what we can do as far as the evaluation and get you to the appropriate surgeon to have, that further addressed.
Definitely.
Sometimes some of the first symptoms relate to the nodule and what it's pressing on. So people might experience difficulty swallowing, food will hang up in the mid-neck area, or they might feel a little bit of an irritant cough that seems to be coming from the neck, a little bit of breathing difficulty, and even voice change.
Okay.
You start to get a hoarseness to your voice.
Okay, so things to take notice of and kind of, all right. So of course, first and foremost, talk to your primary care doctor to kind of decide, okay, let's work through this together. And so what are some things that you want the public to know as far as, we want to raise awareness and know that it's not a scary thing to go to the doctor in general to kind of find out what's going on with your body, but in general, how are we trying to get that conversation going with the community, especially about thyroid issues?
I would say absolutely the first step, you just mentioned it, seeking, your primary care when you're not feeling well, because these are treatable conditions that just need to be addressed, and not to be fearful, the fact that the physician, can help you. So I think just understanding that in general, going and seeing your primary doctor to kind of get the process rolling, for which, you can see, myself as a specialist or, further with the endocrine surgeon specialist to further address the care.
Definitely.
So I have two partners that work with me, Dr. Reinhardt and Dr. Romero. So as a team, we are endocrine surgery specialists. So the word we want to get out is we have this service now in the Valley. You don't have to go elsewhere. And studies clearly show that when surgeons specialize in that little area, the results are better.
Definitely. So of course, so that's really important. So it's something to note, and we have those services here in the Rio Grande Valley. I think that's first and foremost so important. So people don't have to be concerned of having to travel to unfamiliar territory and feeling even more out of their comfort zone, especially with something so delicate as their health. And again, everyone is scared to go to the doctor at some point or another, so I think it's important to not be scared to take your health into consideration and head to the doctor if you're not feeling well. So I think it's great to have you two come on and talk a little bit about this to make it more personal as a chat so that people aren't too scared or too unfamiliar with something like this. So that's great. So if anybody has any information, is there anybody they can contact to get any more information about who to speak to, what doctor to see, who to get in touch? Maybe they do have a thyroid issue and they want to get further help. Is there any way they can do that?
Yeah, from my standpoint, again, I'm working here locally in Weslaco, Texas. I'm kind of new to the area, so little by little I'm getting myself out there. But at the RGV Adult and Geriatric Medicine, we do have the endocrine specialty there. Our phone number we provide, 956-854-4084. You can reach out to us and we can try to get an appointment scheduled, to at least see for your endocrinologist.
Definitely.
And now UTRGV has a joint center with Knapp, the Family Medicine Center that's on the expressway, and we're seeing patients there.
Perfect. Now, quickly before we go, this question just popped in my mind now. Does issues with your thyroid affect anybody at any age range, or does it affect a certain age?
I'm sorry.
No, it's okay.
No, it can affect at any age. Actually, one of the congenital screens that they do right when babies are born, they do a heel prick to look for thyroid conditions. So happens as very young all the way up into, elder life as well too. So it does affect the broad spectrum of age. Absolutely.
Okay. Good to know.
More common in women.
Okay.
Than men.
Absolutely.
All right. Well, it's good to know. So folks, definitely go out and seek your doctors if you have any concerns, questions, or of course they listed their information if you want to further get some more information about any help or treatments. I want to thank you both so much for coming in today. I greatly